Welcome to the Healthy Kids Minute, brought to you by Nemours Alfred I. DuPont Hospital for Children.
There's some potential hazards for children. The one we worry about the most during Halloween is probably the pedestrian in the car. A lot of children are out that night, and it can be dark, of course, if they're trick-or-treating later on, and in communities where there are a lot of children and crossing in the middle of the street and cross driveways. Drivers need to be really careful, of course, and children should always be accompanied by an adult using sidewalks, crosswalks.
Dr. Megan Spear is a pediatrician with Mainline Health's Riddle Pediatrics. She says along with being aware of what's around them, trick-or-treaters should also minimize any danger their costumes may present.
When choosing a costume for your child, you want to make sure it fits appropriately. They don't have any long capes or anything that they can trip on. If you can, you want to get material that's non-flammable for children's costumes. They can use reflective tape on their costumes for better visibility. Children also should always carry a flashlight when they're trick-or-treating, and masks should fit well, or you can use paint instead.
Theatrical contact lenses sold on store shelves have been gaining in popularity among teens for Halloween. But Dr. Spear warns against putting anything in your eyes that hasn't been prescribed by an eye expert.
I would avoid those altogether. If it's improperly fit, it can get stuck in the eye and cause irritation, scratch to the cornea.
Another consideration should be where to go for Halloween treats, and just as importantly, where to avoid.
Never enter houses that don't have a porch light on, and never enter a car for a treat. You can teach children how to dial 911 in case of an emergency. And all treats should probably be inspected when you get home in case there's any potential tampering. Make sure that they're wrapped.
While Dr. Spear stresses that younger children should always be with an adult, those old enough to go out unaccompanied should travel together in a group.
If older children or teenagers are going to be trick-or-treating, they should have a decided upon route and curfew. And again, traveling with a cell phone can be helpful in case of an emergency.
This has been the Healthy Kids Minute, brought to you by Nemours Alfred I. DuPont Hospital for Children.